Hi everyone. So I'm Mike Flower. I'm a neurologist at the UCL Institute for Neurology in London. And I'm grateful to the MDF for inviting me to talk at this Education Day today, and also for supporting me this year with a Young Investigator pilot grant. I'm going to talk a little bit about our research on CSF biomarkers for somatic repeat instability and measuring treatment efficacy in Huntington's disease. Huntington's disease in this crowd needs no introduction. I'll just briefly say that our work is looking at the role of the repeats being unstable and getting bigger over time. So people with Huntington's disease inherit a CAG repeat expansion, which is this orange segment in the DNA stretch here. And over time in blood, that doesn't change a great deal. It expands a little bit throughout the course of a person's life. But in other bits of the body, particularly in parts of the brain, like the striatum, which is particularly affected by Huntington's disease, the repeat gets much bigger over time. And eventually gets big enough that the brain cells, the neurons, become unhappy and start to die. And this causes the symptoms and unfortunately death from Huntington's disease. The next thing I wanted to mention, which is the basis of a lot of the research that we're doing, is the role of DNA repair in Huntington's disease. Now, DNA repair, when people normally talk about DNA repair, they think of it as being protective against mutations. So mutations that cause cancer, for example, the DNA repair system protects against those sorts of mutations. But in the context of Huntington's disease, DNA repair is actually the process by which the CAG repeat is getting bigger. Repair proteins like MSH3 and other proteins that are in that pathway, they see the CAG repeat and they attempt to fix it, but in the process make it longer. And this is an area of intense focus now for new drug development, aiming to have medications which reduce the activity of DNA repair, the specific DNA repair pathways, in order to prevent the repeat from getting bigger and therefore slow down or stop progression in Huntington's disease. Our research, well, what we're aiming to do is to measure CAG repeat expansion and DNA repair activity in the brain, in the central nervous system. But that's currently a very big challenge. And the reason is it's not possible to measure the CAG expansion or DNA repair directly in the brain because you would have to sample the brain itself, which is obviously undesirable during life. We have other ways of sampling tissues and inferring what's going on in the brain. For example, we can sample blood fairly easily. But the difficulty is there's very little repeat expansion in blood, and what there is may not be reflective of what's going on in the brain in terms of DNA repeat expansion, and DNA repair levels in the blood may not reflect what's going on in the brain very well. And this all together makes it very difficult to track how the disease is progressing in terms of CAG repeat expansion, and whether new DNA repair therapies, if they are delivered, whether they work. Because what we would want is we would want to deliver a new DNA repair therapy into the brain and then measure how much it's slowing repeat expansion in the brain, how much it's reducing DNA repair activity in the brain. And that's currently not possible because we can't measure these things in the brain. So the way that we're approaching it is we're using cerebrospinal fluid from HD patients, which you can obtain via a lumbar puncture or spinal tap. And within CSF, cerebral spinal fluid, there is DNA, but it's very dilute and it's not necessarily coming from the brain cells. If you were just to sample the CSF itself, it has very little DNA in it. And what's there is not necessarily coming from the brain cells. But what we're doing is we're isolating small particles from the CSF called extracellular vesicles. These are small particles that get released by brain cells, by neurons themselves. And they're a way of getting things that come from the brain cells themselves. So if you consider the central nervous system, you have the brain and the spinal cord, and the brain and the spinal cord sit in a fluid called cerebrospinal fluid that's provided support. And they release these extracellular vesicles into the cerebrospinal fluid, which is this purple fluid. And that fluid continues on down the back, and we're able to access the fluid via a lumbar puncture by a needle in the back, which, whilst is a little more invasive than a blood test, it's certainly a lot more preferable than brain sampling. And we can collect a reasonable amount of this fluid, and from this fluid we can isolate extracellular vesicles. And these extracellular vesicles contain DNA and RNA and protein that come from the brain cells that release them. And we can use that DNA and protein and RNA to measure CAG repeat instability, to measure the levels of DNA repair proteins. And we've successfully done that. We've managed to isolate and purify these extracellular vesicles. And in doing so, A, we get more DNA, and B, the DNA and protein that we get is coming from the cells that we're interested in. The other aspect of what we're doing in our research is we're actually actively developing these new DNA repair therapies. And we're using cell models for that. We've got stem cells which were kindly donated from HD patients, and we differentiate them, which means we turn them into neurons, specifically medium spiny neurons, which are the cell type most vulnerable to Huntington's disease. And once we've turned them into medium spiny neurons, we apply these new treatments which target DNA repair. For example, the MSH3 antisense oligonucleotides, which is a long word, or potentially better known as an ASO, which lower MSH3 levels. And we, after having treated these cells with their repair therapies like these MSH3 ASOs, we collect the neurons, but we also collect extracellular vesicles that these neurons produce. And then they release them into the media that they're grown in. And we measure repeat instability. So we measure whether these DNA repair therapies can slow down repeat instability in medium spiny neurons. And we measure how much they reduce DNA repair activity. And importantly, we measure how well the extracellular vesicles reflect what is going on in the cells themselves, because that's really important, because when we give these DNA repair therapies to people, it's going to be extracellular vesicles in CSF that we're going to be sampling, and we need to know that what is going on in the extracellular vesicles after we treat the cells is actually true to what is going on in the cells themselves. And in the dish, we can do that exact experiment, and that's what we're doing currently in the lab with this support. Why this matters and what we're doing next? Well, we've already shown that we can measure CAG repeat expansion and the levels of DNA repair genes and proteins in extracellular vesicles from patients and from cells. This gives us a potential way to track HD progression in the brain, and it also allows us to measure whether these new DNA repair therapies can stop CAG expansion without needing to sample the brain itself, which would be very invasive. What are we doing next? Well, we need to after running the experiments with the DNA repair treatments in cells, and also running the CSF that we've collected from HD patients and controls, we need to link these measures of CAG repeat expansion in extracellular vesicles and DNA repair levels. We need to link them to disease progression in patients to see how they change over time, and see what normal repeat expansion in CSF extracellular vesicles looks like. And then, importantly, we need to measure whether these DNA repair therapies have the desired effect on slowing, on reducing DNA repair activity and on slowing CAG repeat expansion. And thereby, we hope, slowing down and preventing the disease from getting worse. There are a lot of people to thank who work in our group. Sarah Tabrizi is the director of our Huntington's disease center here. And in our group, all the people on the left, particularly Marwa El Masri and Lucy Coupland, who work closely with me. And also I'd like to thank Movement Disorders Foundation for their support through this Young Investigators pilot grant, and CHDI and the DRI, who are also funding some of our research.